September is Prostate Cancer Awareness Month. It's a disease that impacts thousands of men every year.
But joining us to talk about the signs and prevention, Dr. Joan Delto, a urologist and associate professor with CHI Health and Creighton University. Thanks for being with us.
My pleasure to be here. Thank you.
Dr. Delto, we mentioned the impact, but there's an easy thing people can do to make a big difference. Screenings, why are they so important?
Right. So prostate cancer is very common among men. 1 out of 8 men will be diagnosed with prostate cancer, and 1 out of 44 men will actually die of prostate cancer. And that makes prostate cancer screening so critical. So prostate cancer typically is a treatable disease, especially if it's caught early on. And oftentimes patients don't have any symptoms. So prostate cancer screening tests like a PSA blood test, which stands for prostate specific antigen, is a good way of catching cancers early on before symptoms occur.
And certain age groups are at higher risk. Why is that?
Yeah, so we know that older men are at a higher risk, but also African American men are at higher risk for prostate cancer. Additionally, men with a family history of prostate cancer, say, for example, family members like brothers, fathers, uncles. And additionally, there are some genetic mutations that are associated with prostate cancers. For example, the BRCA1 and BRCA2 mutations associated with breast and ovarian cancer, as well as Lynch syndrome, which is associated with colorectal cancer.
We've talked about these screenings. When is a good time to start getting screened? And does that vary if you're in one of those higher risk categories?
Yes, that's a great question. So for our patients with a higher risk category, again, family history, African American, these patients should start screening at the age of 40, so earlier on. And these are based on the American Urologic Association guidelines. For those men who are at average risk for prostate cancer, they should start screening starting between the ages of 45 to 50.
Good information. Okay, what's the first step? Do you just make an appointment for a physical?
Absolutely. So speak with your primary care doctor or any provider that you trust about your specific risk and see whether or not you would be a good candidate for prostate cancer screening.
Us guys can be pretty hesitant at times. What would you say to people who just aren't sure if they should get checked?
Yeah, so just start having the conversation. Speak with somebody that you trust, your PCP, your primary care provider, a doctor that you trust. But it's important for us as physicians and healthcare providers to create a safe and open space for us to talk about prostate cancer screening and patient-specific risks.
Dr. Delto, great information. Thanks for joining us today.
Thank you.